Hi, Shani. Thank you so much for coming on the podcast today. How are you?
I'm good. How are you?
I'm doing well, thank you. So you are a certified child life specialist. You help children deal with the misfortune, sorrow, and anguish that life can somewhat cruelly hand even the youngest among us. And
Yes, absolutely.
just to lay the groundwork for today's conversation, can you talk about what exactly a certified child life specialist does, and then what led you to take on this critical but very meaningful career?
Yeah, absolutely. So child life specialists are typically working within a hospital setting. That's where we do our internship. So you have to have a minimum of a bachelor's degree in a field related to child life. So it's usually like child development, psychology, recreation therapy, something like that. Then there's many specialists who will go and get an advanced degree. I actually have my master's specifically in child life. Once you've done your coursework, then you do an internship at a hospital-based setting, and you're under the supervision of a child life specialist. And our role is really there to help support children and families coping with these life stressors, right? Going into the hospital setting, whether you're in there for the emergency room to get stitches or you're in intensive care because you need a heart transplant, we're there to support families through the whole journey. And we're really there to help kids understand what's happening to their body or to their loved one's body. We provide a lot of therapeutic play, creative arts. We come from a background of child development, so we really understand how developmentally children are processing these different life events and how we can come in and intervene so that we can decrease anxiety and trauma and really provide them with an outlet of expression in a healthy way and teach them coping skills, healthy coping skills. And we're there to kind of, advocate for them, teach them how to advocate. We're there to support both the parents and the caregivers. It's a whole type of encompassing, profession. But a lot of child specialists work in a hospital-based setting, and then a lot of them have moved into community-based. So that's where my role is now. I've been community-based for, oh my gosh, like 10 years. I've been doing private practice for almost 7 years. So I actually work with children and families within their own homes, and I provide that same type of service that I did within a hospital setting, but it's in a more intimate space within their own home. And then I work with a lot of community organizations and agencies and nonprofits and provide different workshops, or, we gear things with the population they're serving and the skills that I have, and we kind of create things to support the family members within the community.
I want to talk more about the transition from hospital to homes, but before we get into that, why did you choose this as a career? I mean, from the education standpoint, you have to have some kind of background starting at your bachelor's, so you had to have some kind of outlook and prediction of this is what you wanted to do as a career. How did that manifest itself in your life?
It's interesting. I feel like every child life specialist gets on their journey in a really different way. It's a very unique profession, and it's still so new. I mean, a lot of people don't know what a child life specialist is. Even people who work in the hospital and they might have child life there, they're like, what is that? So mine was kind of naturally, just organically found. I went to San Diego State. I got my degree in recreation admin. And then I remember taking a course in one of our rec therapy classes, and we had a guest speaker come in from the Children's Hospital, which is now Rady's Children's Hospital. And he worked in their convalescent hospital. So he worked with children ages 0 to like early 20s. They were, nonverbal, non-ambulatory, critical care. They couldn't live at home anymore. So they have this hospital where they're getting 24-hour care. And I got to go visit it. And I was like, oh, this makes so much sense. So I kind of got, after I graduated, I ended up working there. And within, honestly, the first 2 months, I was like, recreation admin and therapy is definitely a great job. But I was like, there's something else I'm supposed to be doing, and I cannot figure it out. So I followed the nurses around, OT, speech. Like, I went to the doctors. I was just trying to absorb, like, about their job, how they got into it, what do they love about it, to try to figure out, is that the career path that I'm supposed to shift to? And it wasn't until probably a few months of doing that in this role that one of our patients was referred to the main hospital because she had to have surgery. And my boss was like, oh, we're gonna refer to Child Life. And I'm like, what is Child Life? And he was like, oh, they help them when they have to have surgery. And I'm like, why didn't you ever tell me about this? So I went home and I Googled it and I was like, that's it. Like, that is what I'm supposed to be doing. Like, felt like a strong calling. And I immediately researched graduate programs. I got into it. And then that's kind of how it developed. But I also grew up with a mom with a chronic illness. Like, she was diagnosed when I was 7. So I was very comfortable in the hospital. I understood how to take care of a loved one. I have a lot of empathy. Like, there's a lot of like personal stuff that I went through as a child. And I never had anybody explaining to me what her illness was or why I was having all of these big feelings. And instead of letting them out and then, articulating them, that's not what kids do. Mine was coming out in my behavior. Like, I fought a lot with my brother. Like, there was a lot of anger that we had towards each other. And I think a lot of it had to do with the fact that our mom was really, really sick and we didn't know what was happening. So
well, it's interesting that you mentioned that as a kid, you were not told explicitly what your mother was struggling with. And I've been reading quite a bit about child life specialists and kind of the breakdown of the ages and the developmental stages at which you can identify a certain level of honesty to give the child, or I should say maybe not honesty, but a certain level of vocabulary that you help them develop. And children as young as 6 years old can begin to understand the permanence of illness and death, which to someone who doesn't have a background in this field feels like a remarkably young age to start processing some of the most complicated, intangible, and emotional events of life, even for adults. So is there ever a fear that you can be too honest with children too soon? Or is there always value in giving children the outright truth from a young age so that they can learn to grow with it?
Yeah, so great question. I think honesty is the foundation, 100%. So when I work with families and they have children who are younger than that, they have a 2-year-old and they're like, grandma's sick and she's on hospice. Like, we can't talk to her about this. Like, what do we say? And I'm like, yes, you can. Your language changes, right? The development of a 2-year-old is very different than the development of a 6-year-old and a 10-year-old and a 16-year-old. All it is the words are changed and the way we explain it is different. But you can give them the same information and you can use the words, right? I want families to use the words: cancer, death, dying, name the diagnosis, name the treatment, chemotherapy. It's okay to say those words. It's how we explain it and allowing kids to, we have to trust that they can handle it, and they can. But if we are not honest with kids from the get-go, who the heck are they going to trust? If they can't trust their primary caregivers on giving them information that is a pivotal thing within their lives, they're not going to be able to trust their teachers or their doctors or their dentist or other adults within their lives. So we have to begin at an early age. And even those conversations can be incredibly hard. There's so much value behind it. And we're giving it's a process. These are ongoing conversations that you're going to have. So when I was younger, they talked about the illness. They gave the name of it, but they didn't really describe what that meant. And I remember nobody gave me that information as I hit my new developments, right? So at 7 years old is what I received. When I was 12, when I was 15, when I was 18, I'm like, I was still going back to that 7-year-old state of mind of like the information they gave me. And I was like, this doesn't make sense. And it wasn't until I was older, I was like, I'm just going to research it myself. I had the tools to then look into it and then, oh, now I really understand it. But if my parents or a child life specialist or somebody was able to even know to like, hey, we need to re-educate her again. She's at a new development. I would have been able to handle it, I think, in a much better way. But that's why it's important, those developments. And that's why it's so key to be honest with kids.
I think people may feel defensive when they hear this kind of conversation about being honest from the onset. And because I think a lot of times euphemisms are deployed with the best of intentions of wanting to protect the children and wanting to save them in a certain way from the big scary and the big scaries that may be around them. But it sounds like that's actually very counterproductive, because what you're doing is you are setting a unstable foundation for them to stand on in terms of their understanding of the illness or the big scaries going forward. I mean, the fact that you had the same narrative from 7 to 18 sounds like it was very unproductive in terms of your understanding of your own experience and your own interaction with the illness. You had a relationship with your mother, but you inherently then also have a relationship with what she is going through in her illness, because you are seeing it firsthand, and not being given the tools as you're growing up to be able to cope and digest what you're seeing must have been difficult, and it must have taken, I imagine that some people never are able to fully grapple with the things that they have seen or experienced as children, whether it's firsthand illness or secondhand through a relative that they see go through it, if they're not given the tools and a more stable foundation from the onset.
Yeah, absolutely. And I think that I think you're right, when it comes to the euphemisms, like we do, like I have 2 children. Like I remember when I would have to talk to them about like the death of a family member or the death of our pet, and having that conversation with my husband of like, we have to use the words. And he's like, oh no, like we can't. And I'm like, but we have to. And we have to, because they're capable of understanding it. And truly, it's just a word if you think about it, right? To say that a loved one has passed away or they've gone somewhere else. That is really confusing to a 7 or an 8-year-old. Well, where do they go?
I think it's even confusing as an adult, you know?
100%. Yeah. So I think it's reminding ourselves that children can handle a lot. It's what we provide them around it. It's the explanation. It's the unconditional love. It's the protection and the safety and security to let them know, I'm going to be here with you. We have all these people around you too, in this community that's going to support us through this. And if you ask me questions and I don't know the answer, I will try to find out, and we'll try to ask the doctors, or we'll try to find those answers. And they may not know either, but we will do our best, right? So kids need that. If that's that reassurance, right? We're going to decrease the anxiety. We're going to decrease the trauma if we can lay the framework and the foundation of trust and protection and safety and security. That's going to help them move through this journey.
And so often the tinder that fuels the flames of fear is unknown, and feeling like you are standing in a sea of unknown when it's something that you're experiencing directly, I can imagine feels incredibly scary, especially if you do not feel like you have someone who is your touchstone of truth and kind of the check-in and the reality of what's really going on. And having someone in your life is, whether it be a parent or someone adjacent to you who's doing that for you when you are a young child, I'm sure is critical in, I guess, promoting stable emotional and mental development when it comes to the big truths of life. And so I wanted to go back though, as I mentioned, so you said that a lot of child life, you've transitioned from hospital to being in the community, and now you work in people's homes. I'm curious, is there a certain stability and safety that is inherently there when you're working within the home that makes your work more productive? Do you find it in some sense easier to work when the child is in a familiar space?
Yeah, so it works I think it takes different people, right? So going into a home base, going into private practice is a whole other entity for child life. It's a new thing. The profession is new. Going into private practice is really new. And you have to think of it as a business model. We have to protect ourselves. When you're in the hospital, excuse me, we have those protections and the insurance and the liability, and you have a whole team to protect you. When you're private practice, you're on your own. So you really have to make sure that you're still staying within those professional and ethical boundaries in the scope of child life work, right? We don't want to cross over into areas where other mental health professionals are hitting on, where it's not our scope of service. So that's when you need to know that lane. So reflective supervision is really important, and having liability insurance and all of those things. But when you have all of that lined up and you have the skill set, like the experience of working in a hospital, working with different team members, working and having those experiences in the hospital with patients who are very sick, who are coping with a lot of trauma, the more experience you have, the stronger your skill set becomes. So then you can transition it into their homes. And it's an intimate space. I can see how families interact. I see where they eat dinner at. I see the play space. I see their family pets. It's a safe space for them. And you don't have all of the interruptions that you get within a hospital setting. When I'm having a bedside session with a child, or I'm in a playroom in the hospital with a child, there's people coming in and out. There's doctors and nurses checking the IV pole. And then they're like, oh, we have to take them to go get their MRI now. Like, there's constant interruptions. And when you can create a space within a family's home, you can really, eliminate a lot of that. And that child is comfortable, right? Mm. They're not in a sterile environment. They're in their home environment. And it's a really unique type of experience to have. But it's also one where a child life specialist needs to have their strong boundaries, right? Like, I'm not going to stay for dinner with the family. Like, my role is to provide this service. My role is also to eventually work myself out of the job. I want the families to continue with these tools that I've taught them, because ultimately they're the ones who are going to continue through life. Right? They're going to hit other obstacles. There's going to be bigger challenges. And so if they can go back to that toolbox that I've taught them, they're going to be able to take from that and work through it. It's all resiliency, empowerment, and showing them that they do have the strength and the support, whether it's people within their lives, family members, teachers, coaches, or their community, a church or a baseball team, whatever. It's making sure that the child and the teens know where their support is, that they will be able to navigate through life and other obstacles. But yeah, I love working within their homes. It's amazing.
And is most of your work focused on giving tools and coping mechanisms to the child or teen directly, or is it actually, in fact, giving tools to the support system around them?
It's both. So when I work with the kids and teens, it's a lot of educating them. It's almost like that teacher hat comes on, of like teaching them about the illness, or teaching them about their loved one who's dying, or teaching them about grief and bereavement, and understanding those big emotions and what we do with them. So it's a lot of education. It's a lot of preparation. So if I'm going to work with a child who has to go to the hospital to get an MRI and they're going to be sedated, I'm going to come into their home and I'm going to teach them about what that experience is going to be like for them. I'm going to teach them that they have lots of choices too. In a place where they have a lot of they have a loss of control, I'm going to teach them how they do have control. You can choose to wear these pajamas or these pajamas. You can choose to bring your stuffed animal or your blanket, like any type of choice. So you want to gain that sense of control to them. So it's preparation, education, the expression, right? So allowing them to express themselves through play, through art, through creativity, through verbal expression, like so many ways to let kids get it out. And then that validation from me, I'm really mirroring them. I'm listening, I'm validating all of those emotions, all of them. I'm not going to try to correct them. I'm not going to try to problem solve them. I want them to feel like they're being listened to. And then from there, okay, what do we do with those heavy ones? What do we do with those really ones that are uncomfortable? You can't go and punch your sister. You can't throw a chair at school. But when those big angry feelings come up, and they are going to come up, how do we manage them? How do we put some control on them? I want you to let them out, but let's find other ways to let them out. And so those are those coping skills. And then all of that is translated to the parents. That's a lot of educating for parents and also the community in general. So private practice, there's a lot of educating to community members of like how we can help the families within the community adapt to these really hard things. The pandemic, like how do we support them through this? And giving them that, I just kind of like I feel like when it comes to parents and caregivers, I'm like dusting off. I'm like, you have the skill set. We're just going to dust it off and show you that you do have it. This is kind of, you're going to work it back in. And it works. So it's definitely both. It's working with the parents and the caregivers and the kids.
Two coping, or I guess three coping interventions you've talked a lot about in your work and in this conversation so far involve creative play and art and verbal expression. And from the outside, these practices may resemble non-therapeutic play or just creative time in school and or on the playground. And so how do these practices help children cope? Like, why does that release of emotions, why is that productive?
Yeah, so play is how kids learn, right? It's a foundation. So just like trust is the foundation, right? Play for them is how they understand their world. It's how they process the information. You watch little kids playing house, right? They're taking on the different roles, they're cooking in their kitchen. It's because they're watching their family. They're watching other families, and they're be able to take on these different roles, and you have a lot of power and you have control on it, and you can work through things without judgment and without hurting their ego, and they can really push themselves to understand these things. So in child life, we use, therapeutic play is huge. That's like a key component of being a child life specialist. Medical play is when you bring in real and pretend doctor stuff, like doctor kits, and you let kids explore. You prepare them for what they're going to experience. So if I'm going to prepare a child for that sedated MRI, I'm going to bring in a doll. I'm going to bring in a tourniquet, a mask for breathing. I'm going to bring in gauze, tape, anything that they're going to see in their experience. I want to bring into the environment that's non-threatening, when there's no anxiety, where they can get their hands on it, they can touch it, they can manipulate it, they can use the syringe, we can talk about it, they can have an opportunity to, put it on the doll, or, work on the dolls, or sometimes they do it to me, like whatever it is, it's their way where they can gain mastery and control, where they can express themselves, and they're really just processing. It's their way of processing the information in order to cope with it. And then you do it after. So kids who are in the hospital, we're constantly doing medical play with them. So even though they've had, 15 IVs and they know what it is, they still need that opportunity to work through it. Because maybe that first IV or that second IV that they got was really traumatizing. And in order for them to get over that trauma, we need an opportunity for them to play it out and gain control back and learn that the next time you get an IV, I want to be able to have a choice to sit on my mom's lap. I want to be able to have a choice to have numbing cream on there. I want to have a choice to look at something and be distracted, or I want to have the choice to watch. Like we teach them that even though that experience might have been really negative, we're going to be trying to rewire the brain to understand that you can get through that hard experience again, but in a much more easier way.
These coping skills are really interesting and very powerful, I think, not only for children, but for adults. One example is I work with clinical patients at my job, and we do MRIs. And for people who voice some anxieties around getting into the MRI machine, because it's quite a small bore, the hole that you actually go into. And so we have a mock scanner that we can put them in and take them through exactly what it will be like on the day of, because this comes back to the concept I mentioned previously of so much of the base of fear is unknown, and your brain thinking that the unknown is scary. And so I think it's fascinating that the exact same things that you work with and the goals that you have when working with children to familiarize them and tell their brains that this experience that they are going to have, or that they have already have, is safe, and allowing them to digest it outside of the actual experience itself is something that I see every day with the patients that I work with who are over the age of 25.
Yeah, absolutely. It's kind of fascinating. And if you can start at a young age with kids, then when they are an adult, they're not so scared, right? We're gonna clear up those anxieties. And to have that fear and the anxiety of the unknown, it's a normal reaction. It is inside our brain on purpose to protect us. But sometimes that alarm can be going off and it'll take over. So that logical part of our brain, part of our brain does not have the opportunity to really problem solve through it and tell the anxiety part to like, chill out, it's okay. But if we can practice, if we can let them become familiar, if they have the opportunity to do post play and just get more familiar, work through it, have that opportunity to process it, then it's going to help them cope with their experience, but also cope with future ones.
And so as we wind down, I always liked to give every episode a few practical tips for people to really jot down on their notebook and walk away with. So are there 2 or 3 practical tips that you can give people who are not certified in child life specialty to help discuss either their illness or the child's own illness or death or whatever may be going on within or around them? Are there practical tips that people can deploy to help them communicate these big truths with younger generations?
Yeah. So I think one of the first things I would suggest is for families to have a doctor kit in their house, to have it available, to put real stuff in there too, stuff that their kids are going to see their parents using. So if a parent is constantly taking medication through a syringe, or they've got tubing, or they've got their prescription bottles, put it in there for play, right? Making sure it's all safe, but putting it in there for play so kids can have that opportunity to explore. And then allowing, remember to keep that, the second tip would be to that piece of honesty, to be truthful with kids and to follow the child's lead. So if you're talking to a child about, that you have to go in for surgery, and the child's like, okay, I'm going to go play now. And then you want to chase them down to their room to continue to talk about it. That's when you need to stop, because the child is telling you right there, I'm good. I'm going to go play right now because the information you just gave me was kind of hard to understand. I'm going to go regulate myself. I'm going to go play in my room. I'm going to chill out. And I guarantee you that kid's going to come back later on and they're going to ask you another question. And even if they take off, you can say, okay, go play. And then just know that anytime if you've got any questions, I'm here. I will answer them for you. So you're just letting the child lead, right? And you're going to follow their lead, but you're still opening up that door for conversations for the future. It's going to be an ongoing conversation. So truth, the medical play stuff. And then the other part would be validation of emotions. I would name emotions all the time. How you're feeling, how they're feeling, put it in your language. And I wouldn't highlight always the negative ones. And not to say that everything's the negative ones, that the challenging, right? Not the anger, you're so angry, you're so frustrated, you're so sad. Like you can name the other ones too. Like you're feeling so proud of yourself. You put that entire puzzle together by yourself. Like, oh, you are not giving up. That is really hard for you to tie your shoes. And I can tell you're not going to give up. You want to name the other ones too, those empowering emotions. And that will help build up the vocabulary for kids from a very young age all the way up into adulthood. And it helps them feel validated. So honesty, medical play, validating emotions. Those would be my 3 takeaways, I'd say.
Those sound really useful. And one question I have to ask because I can't help myself. I've been reading a lot about the role of religion and spirituality in adolescence and the role that those beliefs can play in a mental and emotional IQ. I guess not mental IQ, but emotional EQ, I guess they would call it. Emotional intelligence later in life. And so when you enter into this family atmosphere, there are already the beliefs of the parents that I'm sure kind of ebb and flow in your work. And so when it comes to talking about things, especially I guess I'm mostly thinking about death, how do you incorporate being honest and truthful and balancing that with beliefs that the family may hold that, you know, maybe they're not universal beliefs, or perhaps they're not quote unquote like universal truths, because everyone, atheist, non-atheist, whatever religion they're following, may have a different take on what happens beyond life, like physical life on earth. So how do you balance that with the objective truth of the person that you knew is no longer like physically here? You can no longer touch them, if that makes sense.
Yeah, no, it makes perfect sense. So as child life specialists, we really encompass that ethical space of, you know, spirituality, cultural beliefs. I follow the family's leads. I'm very honest from the beginning. Like, do you have a spiritual belief? Do you have a religious belief? If so, what is it? And families will tell you, you know, we believe in heaven, we believe in God, or we don't believe in that. And then the families who I work with, especially for grief, who don't have that space where they're like, we don't believe anything. And they're like, so this is really hard. I don't know what to say. I follow that lead and I incorporate it still in my practice. So I use a lot of books. Bibliotherapy is incredibly powerful for kids because they can relate to the characters. They can relate to the story. They find coping skills within that story. So I use a lot of books, especially for grief and emotions, to help kids cope. So, but I follow whatever their beliefs are. It's not my role to change their spirituality or their religious belief. They say what it is, and then that's the words we also use. So if they call heaven the sky, that's what I use. I use that word too. Yes, they're in the sky. I follow that. I still use the concrete language, and I also encourage the families and I educate the caregivers on the importance of using death, dying, dead, and using those words. But you can still use those words and follow their beliefs, right? Mm-hmm. I think the biggest part for me with grief is to teach families that really it's explaining to the child that the body is no longer working, right? That their heart has stopped beating, their lungs can no longer breathe, that their loved one cannot feel, touch, hear, taste, their body is no longer here, no longer works. And then what we do with that after, whatever their belief is after, I kind of follow their lead and they can still grieve. But it's not my job to change anything. I follow their lead on that and then we work with it.
I think that makes a lot of sense because you want to create an atmosphere around the child that's very cohesive and supportive, and allowing the child to, in some sense, follow, especially at a young age before they're really growing into their own persona and challenging the beliefs of their community. You want them to feel like there's a cohesive dynamic around them, especially in the terms of these difficult life aspects that are difficult to digest, at least. I think the last question I have for you is, so I'm just wondering, like, child life specialist sounds very important. We know that these moments in life, surgery, a diagnosis, a death, mm-hmm. can be very traumatic for children, for anyone truly, but especially for children when they are not able and not given the tools necessary to digest them. And so I have to wonder, like, why do you think certified child life specialties is not caught on like wildfire? Like, why don't more people know about it? I was introduced to it just a few years ago when I actually met someone who was a certified child life specialist. Like, what is stalling the field? What are people missing?
It's funny. It's like, I think if you talk to the students right now who are in the field, they're going to say like, no, don't tell anybody else, because it's flooded right now with students. And we don't have enough institutions and hospitals to provide practicums and internships. So it takes students a very long time to get through this journey to becoming a certified child life specialist. But on the flip side, you're right. There's still so many people who do not know what we do. And really, it's still very much focused on the hospital. A child life specialist outside of the hospital in the community, whether you're working in foster care, you're working in early intervention, you're working in a dental clinic, you're working in a funeral home, you might have the role as a child life specialist, but the title, the name of your role might be different. So I think that the holdup is that we're still a new profession. We're infants, right? We're just in this infancy stage. So that's one holdup. The other holdup is that, child life within a hospital setting is, well, really even community practice too, it's not a billable service. So we are really funded in a hospital setting, primarily a little bit from the hospital budget, and then from grants and donations. So there's not a lot of money there, which means that a lot of hospitals have a very small program because they're relying on people to donate, to fund, to provide them with a child life specialist, to provide them with the supplies, to provide them with resources in a playroom. So funding is very restricted. I think that that's also the struggle, that because the programs can be really small, that there's not a lot of emphasis on it. But I think that we're just still a new profession that's growing. And, I think our profession is learning that we have to make some changes in order for the profession to grow. So there's some internal stuff going on there as well. But, things like this, I think that the pandemic has kind of helped because people are really understanding that mental health wise and mental wellness, we offer a lot of amazing support and services that can filter in so many different ways. It doesn't have to be just a hospital. It could be, natural disasters. It could be working within churches, like so many different ways. So it's just going to be continuous educating, and hopefully we'll be at the toddler stage soon.
And is the oldest age that you work with 18?
It goes to early adulthood.
Okay.
So it's, it's not the whole lifespan, but early adulthood. So there's some kids who would be on an inpatient unit who are still under their parents' insurance and they're 20, right? And you're still working with them. I have a client who's 19, but he developmentally, he's, a little bit more delayed. And so they still have him under the insurance. So I can still see him within that realm. So yeah, but typically it's infancy to early adulthood.
Okay. So final question as we close this out. What do you think the biggest thing is that people miss when it comes to talking to the younger generation, people say 20 and under?
What do they miss in relationship to illness, or just in general?
Let's say in relation to the big truths, illness, death, trauma.
I think that it's interesting. I think that there's new generations coming on, the older generations. I think one thing to keep in mind is how the older generations, how we were raised, right? So our family is raised us differently. We really didn't talk about feelings. We didn't talk about that stuff. It was not, you just sucked it up and you did your thing. I think that there's more awareness, right? There's this awareness of using mental health, of of making sure our mental wellness is being taken care of so that we can then be better human beings and have better self-care and have boundaries to take care of ourselves so that we can be more productive individually, but also a participant in the community and also within our families. So I think that we have to, I feel like there's a shift, there's a big shift. And that if we continue to help the new generation understand that your thoughts, your feelings, your behaviors, those are all valid. And to knowing that too, like things are going to get tough. It is part of life. You know, whose journey has ever been super easy? It's not. The whole part is that your life is supposed to struggle in order to push you out of your comfort zone, for you to grow and continue on to becoming a better human being. So I think that we still want to push the younger generation to get out of their comfort zone. We want them to face those big emotions and those thoughts and feelings and then do something with it, you know, in a productive, healthy, coping way.
I 1000% agree. And I think the whole time I'm not a mom yet. I don't interact with a lot of children, but I know that one, it's very possible for myself and many other people who I do know who are parents who do struggle with this topic of how do you talk about these really difficult aspects of life that adults rarely themselves have the vocabulary to talk about, and give it to a child in a way that is productive. And this has been a fascinating conversation. And I'm even thinking of how can I incorporate, you know, productive play into my life to help me process some of the medical stuff that I've gone through, or even just the big emotions in life. Because I think, I don't know, I'm always on the side of, you know, don't take life too seriously, because it's going to be hard and it doesn't need to be any more serious than it already is. So regardless of if people have children or not, or a lot of children in their life or not, I think this really was insightful and impactful. And I think the work that you're doing is so important. And I do hope that the child life specialist community and profession does grow and becomes a staple, not just in hospitals, but like, as you mentioned, in dentists, in, and in homes and in communities and in community centers and boys and girls clubs across the country, you know, everywhere that, you know, children are, no one's childhood is perfect. And so I think there's an automatic need to have that sounding board, both for parents and for children themselves. And yeah, thank you so much for coming on and taking the time to chat with me and educating me on all things child life specialist.
Oh, thank you for having me. But you had a great, I love your motto of like, you can't take life seriously. Go out and play, like get it out. That's how we regulate ourselves too, right? When I'm having a hard time, like I got to do something physically, I got to do something fun. And it kind of re-centers you. So it's healthy.